Hello, welcome to On My Watch, and I am your host, Dr. Riz, a podcast where we break down healthcare beyond the headlines. Not just what's changing, but what it actually means for you. Today, we're taking a closer look at healthcare laws, and I have personally seen changes. So, we are going to discuss their impact on everyday care, cost, and the decisions patients don't always see coming. Here's the truth: healthcare laws are always changing, but the real question is who actually feels those changes? So, who is actually feeling the pinch and who is not? From new laws and pricing shifts to hidden mechanics of the system, we explore how healthcare really works, clearly, simply, and honestly. Because in healthcare, every change has an impact. And we're here to understand who it's on and how can I help. So, today we're diving into a question that sounds simple on the surface, but gets more interesting the moment you look closer. Who actually wins with new healthcare laws? Because in healthcare, nothing really changes in isolation, right? Every new law is designed with a goal to reduce costs, improve access, protect patients, simplify insurance. Well, those are the main goals, right? And yes, progress is absolutely happening. But the reality is, healthcare is a system where every change creates movement somewhere else. That's why every healthcare law creates winners and losers, not in a good or bad way, but in a distribution of impact way. One group might see lower costs, another might see new rules, another might see, well, how payments or approvals are handled shift behind the scenes. The system adjusts like a set of interconnected gears, let's say. And here's the key point that often gets missed: benefits are rarely evenly distributed. A policy might dramatically improve affordability for someone with chronic illness while having a much smaller impact on a healthy individual who rarely uses care. Or it might help insured patients while leaving gaps for those in a high deductible plans, for instance. The experience isn't one size fits all, it's highly personal. And just as important, costs don't disappear, they shift. If one part of the system pays less, another part often absorbs that change. Sometimes it shows up in a provider reimbursement, sometimes in an insurance design, and sometimes in how services are structured or billed. The total doesn't vanish, it moves around. That's what makes healthcare policy so fascinating and fluid. It's not just about what changes, but where the pressure goes next. And that leads us to most important lens for understanding all of this, right? Which is impact depends on your insurance, your income, your health. Two people can experience the exact same law in a very completely different way. One might feel immediate savings, another might barely notice a difference or may have to pay extra. Someone with ongoing medical needs might feel a big shift, while someone who rarely uses care might see very little change at all. So instead of asking, is this law good or bad, a better question might be, who is this really helping and in what situation? Because once you start looking at healthcare through the lens, you realize something powerful. It's not about simple winners and losers. And this is like kind of interesting here. So, why is healthcare policy so notoriously complicated? It's because we are operating in a shared cost ecosystem where every dollar is connected. When a new law is passed to lower expenses in one area, it doesn't happen in a vacuum. It triggers a financial ripple effect. Think of it as a series of trade offs. If the government caps what you pay at the pharmacy, the system often responds with a offset effect, shifting those costs towards maybe like a higher insurance premium, a reduced provider reimbursement to balance the books. So the challenge is that the key players, patients, insurers, pharmaceutical companies, rarely have aligned incentives, leading to a constant tug of war over who should carry the financial load. Furthermore, because of the lag factor, the changes legislated today often take effect like years in the years to come and and fully manifest in your actual out-of-pocket costs. So you may not see that like for a while. This complexity isn't like a design flaw. It's the natural result of a system where every stakeholder is trying to protect their own bottom line and their own interest. The more you understand these underlying mechanics, the better you can predict how future shifts will actually impact your personal healthcare budget. When we look at changes in the pharmacy space, like price caps, negotiations, new reimbursement rules, it's easy to see the benefit in a specific moment. But the impact is more layered than it looks. For example, take a common medication like a cholesterol drug, such as statin. Let's say new negotiations bring the monthly cost down from $50 to $10 for patients on certain plans. That's a clear, immediate win. If you're someone taking it long term, you're basically thinking, nice, I just got a raise from a pharmacy. But behind the scenes, that reduced price gets absorbed into a broader system of contracts and pricing strategies, which can influence how other medications in the same formulary are priced or placed into different tiers. So while one person is saving on statin, another patient might open their app and think, why did my allergy medication just develop a personality and become more expensive? The key point is that savings in healthcare are rarely uniform. They show up in a specific place, while adjustments quietly happen elsewhere, and your actual benefit depends entirely on your drug mix, insurance design, and overall health needs. In other words, healthcare doesn't change prices, it rearranges them. Okay, so let's talk about the big push for price transparency. In theory, being able to shop for an MRI like you shop for a flight sounds like a dream, right? It's a huge win for employers and researchers who can finally see those massive price variations across town. But here's a professional reality. I want you to consider just because the data is public doesn't mean it's actually easy for you or me to use. Think about it. Most of us don't have the time to decode thousands of complex billing files when we're just trying to get healthy. Plus, there's a strategic shift happening behind the scenes. When hospitals are forced to show lower prices on shoppable items like imaging, for instance, right? They often adjust or they may often adjust their rates elsewhere to protect their bottom line. My big punchline for you is this: transparency does not equal simplicity. It's a powerful tool, but it takes a lot of legwork to turn a visible price into a lower bill. For us to be savvy, here's the goal. This just isn't to find the price, it's to understand the strategy behind it. The real trick to mastering the system is realizing that a low cost plan is often just a high stakes bet on your own future health. For instance, imagine choosing a plan with a very low monthly premium but a $6,000 deductible. If you stay healthy, you win. You barely spend anything. But if you suddenly need an MRI or an ER visit, you're now responsible for thousands of dollars before insurance fully kicks in. So you have to be careful what side you bet on. The ultimate takeaway in the world of healthcare finance: you aren't just buying insurance, you're choosing which side of the risk you want to be on. So essentially saying that I won't be going to the ER or needing MRI, well, that's your bet. Hey guys, when I zoom out and connect all of this, a bigger pattern starts to show up. And so will it happen for you because healthcare policy rarely just reduces costs, it mainly redistributes them. In other words, when a new law says patients pay less here, that doesn't mean the system is suddenly cheaper overall. It usually just means the bill quietly moves somewhere else in the chain. For example, think about a law that lowers the out of pocket cost of insulin for patients. A very common example, right? For someone with diabetes, that's a very real and immediate win. They might go from paying hundreds a month to something much more manageable. But insulin doesn't become cheaper to produce overnight. Instead, that financial pressure gets absorbed elsewhere in the system, whether through insurance pricing, manufacturer negotiations, or adjustment in how costs are balanced across other medications or services. And that's where things start to get interesting. We tend to notice the visible wins, like patients saving money at the pharmacy counter or getting protection from a surprise bill. But what we don't always see is the invisible shifts happening behind the scenes, like adjustment in insurance premiums, changes in providers' payments, or even subtle changes in how care is delivered over time. The system naturally finds an equilibrium again, almost like it's constantly rebalancing itself when pressure is applied in one area. And the part that really makes it personal is that none of this looks the same for everyone. Whether you win or barely feel a change depends entirely on your own mix of age, insurance type, health status. So when you step back, the real story isn't just about policy changes or new laws or new healthcare laws. It's about how those changes filter differently through every individual situation. In a zero sum system, someone is always holding the tab. True healthcare literacy means looking past the discount to see who is picking up the check. If there's one takeaway from all of this, it's that healthcare laws don't simply make the system cheaper or more expensive. They reshape how costs flow through it and who feels them more directly. Some changes create real visible wins at the patient level. Others would shift the pressure into places that are less obvious. And most land somewhere in between, right? That's why it's so important to look beyond the headline and what's actually changing underneath. And more often than not, the answer depends on your own unique, customized situation, your health, your coverage, and the kind of care you end up needing. So, for instance, if your loved one is now paying less for a medication like insulin or another routine prescription, that's a real win you can see right away, right? But it's still worth stepping back and asking the second question. Did anything else in their overall care change? Am I paying for something else, or if they are they paying more for something else? Maybe another medication went up slightly, or a specialist visit became more expensive under a different billing structure. The point isn't that one cancels out the other, but that healthcare shifts in pieces, not in isolation. That's very important to understand. So I'll leave you with this. In healthcare, the question isn't just what changed, it's how did it change for me? And if this helped make things a little clearer, feel free to share it with someone who could benefit from understanding it too, because these are the kinds of changes that affect all of us, even if we don't notice them right away. Thank you for listening to On My Watch. I appreciate you spending this time with me. I know I always enjoy it, and I'll see you in the next one as we keep breaking down the system, one piece at a time. Stay out of trouble and stay informed. Thank you.